Hello, class. For today's lesson on respiratory disorders, we will be discussing pneumothorax and the use of chest tubes. Upon completion of this lesson, the student will be able to explain the four major causes of pneumothorax, describe the purpose of a chest tube, identify the components of the closed chest drainage system, and identify appropriate nursing interventions when caring for patients with chest tubes. Let's begin by discussing what exactly a pneumothorax is. A pneumothorax is the presence of air or gas in the pleural cavity between the lungs and the chest wall. When this occurs, it causes the lung to collapse. In the picture below, you will see an example of a fully inflated lung and a collapsed lung. There are four different types of pneumothorax, which I will discuss briefly. The first is a traumatic pneumothorax, which occurs as a result of injury to the chest. An example would be that of a car accident or a stab wound to the chest. The second is a tension pneumothorax, which occurs when pressure inside the pleural cavity is greater than the outside atmospheric pressure. Tension pneumothorax is fatal because it can cause the entire lung to collapse, pushing the heart towards the lung and thus putting pressure on both sides of the chest wall cavity. Please pause this tutorial and read the caption below the picture. Resume when finished. Next, we have a primary spontaneous pneumothorax, which occurs when an air bubble on the lung ruptures for no apparent reason. You might see this in a person who has undergone changes in atmospheric pressure, such as when scuba diving or mountain climbing. And last but not least is a secondary pneumothorax. Secondary pneumothorax occurs in patients who have existing lung disease. This occurs due to the diminished lung capacity as a result of disease progression. Now that we understand a little about the pathophysiology and causes of pneumothorax, we will discuss the most common medical intervention, which is the placement of a chest tube. You might be asking yourself, what is the major function of a chest tube? Well, a chest tube is a drainage tube that is generally inserted by a physician who specializes in general or thoracic surgery, or by an emergency medicine physician in the event of a traumatic pneumothorax. The chest tube is generally inserted above the second intercostal space to drain free air, or inserted to drain fluid between the fourth or fifth intercostal space, usually located at the mid-axillary line of the affected lung. Once inserted, the chest tube is connected to a closed chest drainage system, often known as an atrium, which allows for the drainage of free air or fluid from the pleural space. I will go into more detail about the atrium on the next slide. Here is a picture of the ocean atrium. Please keep in mind that the closed chest drainage system may look different at the hospital where you practice your clinical rotations. However, the mechanism will be the same. As you will see on the ocean atrium depicted to the left of this slide, each chamber is labeled either A, B, C, or D. Each chamber has a different function. Chamber A controls the amount of suction that is to be applied. Chamber B is the water seal chamber, which serves as a simple one-way valve which prevents air from returning to the patient's pleural cavity. Chamber C is where you will monitor for air leaks due to changes in pressure in the pleural space. And Chamber D is where fluid will drain from the patient if the drainage is present. To the top right of this picture, you will see where the chest tube enters the atrium from the patient. On the top left of this picture, you will see an area that says "to suction." Suction is only applied if the doctor's orders indicate to do so, otherwise the atrium will be left to water seal. We will discuss suction and water seal and the various other components of the closed chest drainage system at a later time. On this last slide, we will be discussing a few nursing interventions that are specific to the care of the patient with a chest tube. The standards of care described in this slide are only recommendations. Please be sure to check with your clinical site to ensure that you are following their protocol on chest tube care. I will refer to the closed chest drainage system as the atrium, as described on the previous slide. Every 2 hours, or with sudden changes in patient condition, a nurse should conduct a respiratory assessment, including lung sounds, pulse oximetry, and rate and work of breathing. Inspect the dressing, ensuring that an occlusive dressing is present around the insertion site and that is covered with a dry dressing. Make sure to note any drainage. Ensure the tubing from the patient to the atrium is free of kinks, occlusions, or dependent loops which can impede drainage into the atrium. Assess the appearance and amount of drainage, if any, in the fluid collection chamber of the atrium. Always keep the atrium below the level of the patient's chest. Have the patient take deep breaths and monitor for fluctuations or continuous air leaks in the water-sealed chamber. We will discuss this in further detail in a subsequent lesson. Last but not least, document your findings. If you didn't document it, it didn't happen.